So first of all, we have to remember that this applies to patients undergoing breast conservation therapy with radiation. Now, that doesn't mean that it won't apply to patients undergoing mastectomy, and we know that some patients with mastectomy have radiation. But under the current guidelines, we're really talking about breast conservation with radiation. So it's easy. If the patient in front of me looks like a patient on the Z11 trial, and many do, and I have a micromet in a sentinel node or two, I'm not compelled to remove the extra axillary lymph nodes. However, if I have a 35-year-old Caribbean American woman with a triple negative breast cancer who's having a mastectomy, and she has cancer in the lymph nodes, I don't think Z11 applies, and I think I'm going to take some lymph nodes out in that patient. One of the messages, I think, is that even with the best of trials and the best of studies, there's still room for clinical judgment. You still have to do what you think is best for the patient that's in front of you.